Integrated Personal Commissioning, or IPC, is an innovative practical delivery model that enables the NHS and local authorities to join up their approach by providing health and social care services around the individual. It is a new model which can be implemented locally using existing powers and duties, and it's a key bridge towards securing the future sustainability of the NHS. It ensures that people are seen as experts in their own condition and partners in their care, rather than passive recipients of services. Better joint working across health and social care is vital to improving health outcomes, both for individuals and the system, but our attempts have often failed to recognise the pivotal role that people themselves play in integrating their own care.
IPC helps people to find new and better ways to meet their health and wellbeing needs and make less use of formal health and social care services. This works by enabling people to make more use of their own strengths and abilities and what's available in the local community. For example, in the case of loneliness, which affects a lot of older people living in the community, the answer often lies by really connecting people up to other people with lived experience or other people in their community, rather than traditional support.
IPC is the backbone for providing this more personalised approach and sets out in practical steps how the NHS and local authorities can join up health, social care and education at the level of the person through a single person-centred plan which focuses on what matters to that individual.
So who benefits from this approach?
The IPC programme is of particular benefit to disabled people and those with long-term conditions and complex needs. Currently, these groups make up about 30% of the population and account for 50% of all GP appointments and occupy 70% of hospital beds. The benefits are increasingly recognised that this approach can bring to the system and to individuals.
So how do we make this happen? Well, the IPC delivery model sets out practical steps that commissioners and providers can use to join up health, social care and education. It provides a whole system approach to personalisation and delivering personalised care at scale. So what's changing?
For IPC to be really effective, there needs to be 5 key changes in place.
The first change is proactive coordination of care. So the IPC model helps to identify the people who have a lot of contact with the system and looks at what's working and not working from their perspective and from the perspective of the local system. So it enables you to target people who will benefit most from this approach.
In life, we don't make that easy distinction between what's social care and what's healthcare. I know certainly for me, as my health condition has progressed and deteriorated, I've still got all social care stuff as well.
The second change is community capacity and peer support. So IPC really focuses on people's strengths and how to get support from peers in the local community. So it's about really finding out what matters to people and through community navigation and social prescribing, making full use of the assets in the community and support from other people.
Having mental health challenges, often you can feel that you don't really want to kind of talk about that because it's still a taboo in society. But going to a peer support group where everyone's had mental health challenges, you feel really free.
The third change is person-centred care and support planning. This is a better conversation, a conversation about what matters to you as well as what's important for your health and well-being. It builds on people's skills, confidence and aspirations so they can take more control over their plan. It provides a one-plan approach, so it brings the whole multidisciplinary team around the individual.
My own package is joint funded, so I'm 60% funded by social and 40% funded by health. So it took both agencies coming together to work out how best to manage my care, to fit it around me and what mattered to me.
The fourth change is choice and control. So some people would be eligible for a personal health budget, and it's looking at how we can be really flexible with the resources that are already available in the system. IPC is also helping drive the uptake of personal health budgets, with now over 23,000 people holding a personal health budget, with many living in areas that are currently engaged in the IPC programme.
What I love about IPC, it puts the person in a driving seat of their care. So they're the ones who decide how they want to live their lives, what risks they want to take.
And the fifth change is personalised commissioning and payment, so more choice of support.
I believe that through partnership work in IPC and personal health budgets will make a real difference to people's lives and think about contracting in a different way.
These changes will only work if they're designed and developed with people with lived experience, so disabled people and people with complex needs and their families. So it's really important that they're involved right from the beginning.
And these changes need to be championed at a senior level across the system. It needs system leadership. Good attention needs to be paid to the workforce development so that you're changing both the culture and redesigning the workforce to be able to deliver personalised care.
So in summary, integrated personal commissioning is a practical delivery model for commissioners and providers that enables the NHS and the local authorities to join up and personalise their approach.
IPC improves people's health and wellbeing outcomes by giving them more choice and control. It can also reduce crisis in people's lives that lead to unplanned hospital admissions or admissions into institutionalised care. It can also deliver improved value for health and care system by improving quality, integrating care and supporting inappropriate demands and costs.
I hold a personal health budget for my son. At the moment he's stable with his seizures. He's not been to hospital for 12 months. He hasn't had an infection for a long time. He's alert, he's happy.
We have plenty of resources and guides about IPC on our website, so please do take a look and sign up to our learning network to receive our latest updates.